Migraine is a common neurological condition that affects millions of people worldwide. It is often characterized by severe headache pain, as well as a range of other symptoms such as nausea, vomiting, and sensitivity to light and sound. But did you know that migraine is often comorbid with other conditions, meaning that people with migraine are at higher risk for developing other health problems? In this video, we'll be discussing 10 helpful pieces of information about comorbidities of migraine and their association with other conditions. From depression and anxiety to cardiovascular disease and autoimmune disorders, we'll explore the many ways that migraine can affect the body and the potential links between these conditions. Whether you're someone who experiences migraine or just curious about the condition, this video will provide valuable insights into the complex nature of migraine and its impact on overall health. 1. Migraine is often comorbid with depression, anxiety, and other mood disorders. The connection between migraine and mood disorders is complex and not fully understood, but research has shown that there is a clear link between the two conditions. For example, a 2016 study published in the journal Headache found that people with migraine were more likely to experience depression and anxiety than those without migraine. The study also found that the frequency and severity of migraine attacks were associated with greater levels of depression and anxiety. It's not entirely clear why migraine and mood disorders are comorbid, but there are several potential explanations. One theory is that there may be shared underlying mechanisms that contribute to both conditions, such as abnormalities in serotonin levels or the hypothalamic pituitary adrenal (HPA) axis. Another possibility is that the pain and disability associated with migraine can contribute to the development of mood disorders, as chronic pain and illness are known risk factors for depression and anxiety. Regardless of the cause, it's clear that the comorbidity of migraine and mood disorders has significant implications for treatment and management. Individuals who experience both conditions may require a more integrated treatment approach that addresses both the physical and emotional aspects of their health. This may include medication, therapy, lifestyle changes, and other interventions that can help manage both migraine and mood disorders. 2. Chronic pain conditions like fibromyalgia and chronic fatigue syndrome, CFS, are often comorbid with migraine, and there may be several reasons why this is the case. One possibility is that the conditions share common underlying causes, such as altered pain processing and neurotransmitter imbalances. For example, research has shown that people with fibromyalgia and CFS may have abnormalities in the levels of certain neurotransmitters, such as serotonin and dopamine, which are also implicated in migraine. These imbalances can contribute to both pain and mood disturbances, which are common symptoms of all three conditions. Another possible explanation is that chronic pain conditions and migraine can both be triggered or exacerbated by stress and other environmental factors. For example, stress can increase muscle tension and trigger migraines, while also contributing to the development of fibromyalgia and CFS. Additionally, sleep disturbances are common in all three conditions, which can further exacerbate symptoms and make it difficult to manage. Overall, the comorbidity of migraine with chronic pain conditions like fibromyalgia and CFS highlights the need for a comprehensive approach to treatment and management. This may involve a combination of medication, lifestyle changes, and other interventions that target both pain and mood symptoms, as well as addressing any underlying causes or triggers of the conditions. 3. There is a well-established link between migraine and gastrointestinal disorders, particularly irritable bowel syndrome, IBS. People with migraine are more likely to experience IBS than those without migraine, and research has shown that the connection between the two conditions may be related to the role of serotonin in both. Serotonin is a neurotransmitter that plays a key role in regulating mood, appetite, and gastrointestinal function. It is also involved in the development of migraine, as many migraine medications target serotonin receptors in the brain. Research has shown that people with IBS may have alterations in the levels of serotonin in the gut, which can contribute to symptoms like abdominal pain, bloating, and changes in bowel habits. It is thought that the alterations in serotonin levels that contribute to IBS may also play a role in the development of migraine. Some studies have shown that people with migraine may have lower levels of serotonin than those without migraine, which can contribute to the development of pain and other symptoms. Additionally, changes in gut motility and function that are seen in IBS may also play a role in triggering migraines. Overall, The comorbidity of migraine and IBS highlights the need for a comprehensive approach to treatment and management. This may involve a combination of medication, dietary changes, stress reduction techniques, and other interventions that target both conditions and any underlying causes or triggers. 4. Sleep disorders like insomnia and sleep apnea are often comorbid with migraine, and there may be several reasons for this. One possibility is that disrupted sleep patterns can trigger migraine attacks, and migraine pain can also disrupt sleep, leading to a cycle of sleep disturbances and migraine attacks. Research has shown that people with migraine are more likely to experience sleep disturbances, including difficulty falling asleep, staying asleep, and feeling rested upon waking. Additionally, sleep disturbances have been identified as a trigger for migraine attacks in some individuals, likely due to disruptions in the body's natural sleep-wake cycle. Conversely, migraine pain can also disrupt sleep, as the pain can make it difficult to fall asleep or stay asleep. This can further exacerbate the cycle of sleep disturbances and migraine attacks, leading to a chronic and debilitating condition. Overall, the comorbidity of migraine and sleep disorders highlights the need for a comprehensive approach to treatment and management. This may involve a combination of medication, lifestyle changes, and other interventions that target both conditions and any underlying causes or triggers. For example, practicing good sleep hygiene, such as establishing a regular sleep schedule, avoiding caffeine and alcohol before bed, and creating a comfortable sleep environment, may help improve sleep and reduce the frequency and severity of migraine attacks. 5. Cardiovascular conditions, including high blood pressure and heart disease, are more common in people with migraine. Recent research has suggested that migraine may be a risk factor for cardiovascular disease, and that both conditions may share common genetic and environmental risk factors. For example, studies have shown that people with migraine may be more likely to have certain cardiovascular risk factors, such as high blood pressure, high cholesterol, and obesity. Additionally, research has suggested that migraine may be associated with an increased risk of stroke, particularly in women. The exact mechanisms underlying the link between migraine and cardiovascular disease are not yet fully understood. However, it is thought that both conditions may share common genetic and environmental risk factors, such as inflammation, oxidative stress, and alterations in the function of blood vessels. Overall, the comorbidity of migraine and cardiovascular conditions highlights the need for careful monitoring and management of cardiovascular risk factors in people with migraine. This may involve regular monitoring of blood pressure and cholesterol levels, lifestyle modifications such as regular exercise and a healthy diet, and medication management as needed. Additionally, migraine-specific treatments may also be important in reducing the frequency and severity of migraine attacks, which may in turn reduce the risk of cardiovascular events. 6. Hormonal changes, particularly those that occur during menstruation and pregnancy, can trigger migraine attacks in some individuals. This may help explain why women are more likely to experience migraine than men. Research has shown that the fluctuations in hormones that occur during the menstrual cycle can trigger migraine attacks in some women. This is thought to be related to changes in estrogen and progesterone levels, which can affect the function of blood vessels in the brain and trigger migraine pain. Similarly, hormonal changes that occur during pregnancy can also trigger migraine attacks in some women. This may be related to fluctuations in estrogen and progesterone, as well as changes in blood volume and circulation that occur during pregnancy. Overall, the comorbidity of migraine and hormonal changes highlights the need for a personalized and comprehensive approach to treatment and management. This may involve a combination of medication, lifestyle modifications, and hormonal therapies, depending on the individual's specific symptoms and triggers. For example, hormone replacement therapy may be useful for some women with migraine who experience hormonal fluctuations, while lifestyle modifications like stress reduction techniques and dietary changes may also be helpful in reducing the frequency and severity of attacks. 7. People with migraine are at higher risk for developing epilepsy, and vice versa. Both conditions may be related to abnormal electrical activity in the brain. Epilepsy is a neurological condition characterized by recurrent seizures, which are caused by abnormal electrical activity in the brain. Migraine, on the other hand, is a neurological condition characterized by recurrent headaches that are often accompanied by other symptoms, such as nausea and sensitivity to light and sound. While the underlying causes of these conditions are not fully understood, both are thought to involve abnormal electrical activity in the brain. Recent research has suggested that there may be a bidirectional relationship between migraine and epilepsy, meaning that people with migraine may be at higher risk for developing epilepsy, and vice versa. Additionally, there may be shared genetic and environmental risk factors that contribute to the development of both conditions. Overall, the comorbidity of migraine and epilepsy highlights the need for careful monitoring and management of both conditions. This may involve a combination of medication, lifestyle modifications, and other interventions that target both conditions and any underlying causes or triggers. For example, anti-epileptic medications may be useful in treating both migraine and epilepsy, while lifestyle modifications like stress reduction techniques and dietary changes may also be helpful in reducing the frequency and severity of attacks. 8. Autoimmune disorders, such as multiple sclerosis and lupus, are more common in people with migraine. The connection between these conditions is not fully understood, but it may be related to immune system dysfunction. Autoimmune disorders occur when the body's immune system mistakenly attacks its own tissues and organs. Multiple sclerosis, for example, is a neurological autoimmune disorder that affects the central nervous system, while lupus is a systemic autoimmune disorder that can affect multiple organs and tissues. Research has suggested that people with migraine may have an increased risk of developing autoimmune disorders, and that the two conditions may share common genetic and environmental risk factors. Additionally, some studies have found evidence of immune system dysfunction in people with migraine, which may contribute to the development of both conditions. Overall, the comorbidity of migraine and autoimmune disorders highlights the need for a comprehensive and individualized approach to treatment and management. This may involve a combination of medication, lifestyle modifications, and other interventions that target both conditions and any underlying causes or triggers. For example, immunomodulatory therapies may be useful in treating both migraine and autoimmune disorders, while lifestyle modifications like stress reduction techniques and dietary changes may also be helpful in reducing the frequency and severity of attacks. 9. People with migraine are more likely to have allergies and asthma than those without migraine. This may be because these conditions share common inflammatory pathways. Allergies and asthma are both characterized by inflammation of the airways and other tissues in the body. Migraine, on the other hand, is a neurological condition characterized by recurrent headaches that are often accompanied by other symptoms, such as nausea and sensitivity to light and sound. While the underlying causes of these conditions are not fully understood, all three conditions involve inflammation and immune system activation. Recent research has suggested that there may be a link between allergies, asthma, and migraine, with some studies finding evidence of increased prevalence of these conditions in people with migraine. The exact nature of this link is not fully understood, but it may be related to shared inflammatory pathways or other biological mechanisms that contribute to the development of all three conditions. Overall, the comorbidity of migraine, allergies, and asthma highlights the need for a holistic and individualized approach to treatment and management. This may involve a combination of medication, lifestyle modifications, and other interventions that target both conditions and any underlying causes or triggers. For example, anti-inflammatory medications may be useful in treating both migraine and allergies, asthma, while lifestyle modifications like avoiding triggers and practicing stress reduction techniques may also be helpful in reducing the frequency and severity of attacks. 10. Migraine is also comorbid with a variety of other conditions, including tinnitus, temporomandibular joint disorder, TMJ, and Raynaud's phenomenon. The connection between these conditions and migraine is not fully understood, but may be related to shared underlying mechanisms such as abnormal blood vessel function or nervous system dysfunction. Tinnitus is a condition characterized by ringing or buzzing in the ears, while TMJ involves dysfunction of the jaw joint and surrounding muscles. Raynaud's phenomenon is a condition in which blood vessels in the extremities, e.g. fingers and toes, constrict in response to cold or stress, causing pain and discoloration. Research has suggested that there may be a link between these conditions and migraine, with some studies finding evidence of increased prevalence of these conditions in people with migraine. The exact nature of this link is not fully understood, but it may be related to shared underlying mechanisms that contribute to the development of all four conditions, such as abnormal blood vessel function or nervous system dysfunction. Overall, the comorbidity of migraine with these other conditions highlights the need for a comprehensive and individualized approach to treatment and management. This may involve a combination of medication, lifestyle modifications, and other interventions that target both conditions and any underlying causes or triggers. For example, medications that improve blood flow may be useful in treating both migraine and Raynaud's phenomenon, while physical therapy or other interventions to improve jaw function may be helpful in treating both TMJ and migraine. Understanding the comorbidities of migraine is an important step in managing this condition and improving overall health. By recognizing the potential links between migraine and other health problems, individuals can work with their healthcare providers to develop effective treatment plans that address all of their health concerns. If you experience migraine or any of the conditions discussed in this video, it's important to talk to your healthcare provider about your symptoms and any potential risk factors. With proper care and management, it is possible to live a healthy, fulfilling life with migraine and its comorbidities.